It doesn't matter if a supplement or vitamin has clinical proof to show that it helps with diabetes or complications linked to it. The more important question is, will taking this supplement or vitamin hurt you? Vitamins are important for maintaining your health in general because they do many things, like boost your immune system and make your bones stronger. Diabetes patients, on the other hand, may have trouble with their body's ability to process and use some vitamins. Because diabetes makes it harder to absorb nutrients and can cause vitamin shortages, people who have it need to carefully watch how many vitamins they take in. Vitamin supplements can be combined with diabetes medicines, and diabetics have special dietary needs. Because of these factors, taking vitamins should be carefully thought out, and in some cases, discussed with a healthcare provider to make sure it is safe and helpful. In this video, we will explore the most dangerous vitamin for diabetics. Number 7. Chromium. Chromium is an important mineral that can be found in foods like nuts, fruits, veggies, meat, and grains. It helps keep blood sugar levels in check. A chromium shortage is not common, but it can cause blood sugar to rise. People with diabetes who take insulin or oral medicines to lower their blood sugar could get hypoglycemia, which is a dangerously low blood sugar level if they take chromium supplements. The American Diabetes Association says that people with kidney disease should not take chromium pills because they might make their kidney problems worse. Also, chromium can combine with some medicines, like levothyroxine, which is used to treat hypothyroidism, which could make them less effective. People who are thinking about taking chromium vitamins should talk to a doctor first, especially diabetics and people who already have health problems. Number 6. Bitter melon. People are interested in bitter melon as a natural vitamin because it may help people with diabetes lower their blood sugar levels. This is because it has active ingredients like vicine, bitternin, and polypeptide P. People think that these parts work like insulin, which is a key hormone for controlling blood sugar. However, a thorough review and study published in Nature showed that the results about how well bitter melon works were not always the same. The current studies have very different lengths of time and doses, which makes it hard to come to firm, long-term conclusions about its safety and effectiveness. Also, people who often have hypoglycemia should be extra careful with sour melon because it may make the risk of dangerously low blood sugar even higher. This shows how important it is to do more study to fully understand how bitter melon affects people with diabetes and whether it is a good choice for managing the disease. Number 5. Green tea. Many studies have shown that drinking green tea might be good for people with diabetes. A review of 17 clinical studies, which was published in the American Journal of Clinical Nutrition, showed that drinking green tea can help. It can lower fasting glucose levels and hemoglobin A1C, which is a measure of average blood sugar over 3 months. However, there isn't a lot of research on green tea extract pills, especially when it comes to studies that don't involve animals. Most of the studies that have been done are short-term. So, it looks like the extra health benefits of taking green tea extract in addition to drinking green tea might not be worth it based on the information we have now. Number 4. Vitamin E. Vitamin E is known for being a powerful antioxidant. It is an important part of fighting oxidative stress, which can lead to type 2 diabetes or make it worse. Because it can get rid of free radicals, it helps keep cells from getting damaged, which can cause long-term diseases like diabetes. Taking vitamin E with blood-thinning drugs, on the other hand, is very dangerous because it can make you more likely to bleed, because it blocks vitamin K from clotting. People with diabetes, especially those who take blood thinners, could get sick if they take vitamin E pills without supervision. Number 3. Vitamin B12. Vitamin B12 is important for nerve health and preventing neuropathy, a disease that damages nerves and can get worse if you have diabetes or don't get enough B12. People with diabetes, especially those who take metformin, a drug that can lower B12 levels, may be more likely to develop neuropathy. B12 helps make red blood cells and keeps the nervous system healthy, which stops signs like tiredness and memory loss. Diabetics, especially those who take metformin, need to keep an eye on their B12 levels. Number 2, niacin. Niacin, which is also called vitamin B3, is often taken to raise HDL cholesterol, which is the good cholesterol. However, it can have effects on people who are controlling their diabetes. Niacin has been shown to raise glucose levels in people with diabetes. This could make it harder to control blood sugar and make managing diabetes more difficult. It may seem like a good idea to raise HDL cholesterol levels, but there is no solid evidence that doing so lowers the chance of heart disease. Also, taking niacin with diabetes medicines could make it harder to control blood sugar, so its use needs to be carefully considered. Because of these things, like the balance between risk and benefit and the possible effects on the heart, it is important to talk to a doctor before taking niacin. Number 1, St. John's wort. More research needs to be done on how St. John's wort affects diabetes, especially how it interacts with diabetes drugs and how it might affect insulin sensitivity and secretion. 20 fit men took part in a small study published in the British Journal of Clinical Pharmacology that showed that taking St. John's wort with metformin could increase insulin production and lower blood sugar levels after a glucose tolerance test. On the other hand, a small study with 10 healthy men found that St. John's wort alone did not improve insulin sensitivity, but it did lower insulin secretion, which could cause blood sugar levels to rise. These early studies were limited by their small size, lack of variety, and short amount of time. They show that we need more in-depth studies to fully understand how St. John's wort changes insulin functions and how it works with other drugs. The American Diabetes Association also says that people with diabetes and heart disease who take blood thinners should stay away from St. John's wort because it can make bleeding more likely. Let's explore how these vitamins affect diabetes. Some vitamins can make diabetics' blood sugar levels go up or down or make insulin less effective, which could make managing diabetes harder. These vitamins could mess up the way glucose is broken down or how insulin works, which could cause blood sugar levels to change without warning. People with diabetes should watch out for signs like feeling tired all the time, having to go to the bathroom a lot, having blurry vision, or seeing unexpected changes in their blood sugar levels. These could be signs of bad reactions to vitamin supplements. People with diabetes should talk to their doctors before starting a new vitamin plan to make sure it doesn't interfere with how they're managing their diabetes. As part of our research into the most dangerous vitamin for diabetics, we found that chromium, bitter melon, green tea extract, vitamin E, vitamin B12, niacin, and St. John's wort may interact negatively with diabetes patients. These chemicals can change blood sugar levels, insulin sensitivity, and the way diabetes medicines work, which could make managing diabetes more difficult. For example, chromium might lower blood sugar too much when taken with diabetes drugs, and niacin might raise glucose levels when taken first thing in the morning. In the same way, St. John's wort might not work well with medicines for diabetes and heart disease. For these reasons, people with diabetes should talk to their doctors before adding any new vitamins or pills to their routine to make sure they don't have any bad effects on their health or ability to control their diabetes. If you found this information useful, don't forget to subscribe, share, and comment. Also, look in the description for a link to our video on whether dates are good for diabetes, if you want to learn more about how to manage diabetes well.